Omega-3 fatty acids are believed to be beneficial for reducing the risk of heart disease. They are often used in combination with diet and exercise to lower levels of triglycerides and increase levels of HDL cholesterol. However, it is important to be cautious of potential impurities or additives in some supplement products. It is recommended to consult with your pharmacist for more information about the specific brand you are using. It's also important to note that the U.S. Food and Drug Administration has not evaluated the safety or effectiveness of this product, so it's best to consult with your doctor or pharmacist for more details before taking it. When taking this product, make sure to follow the directions on the package label. If you have any questions, it's best to consult with your doctor or pharmacist for guidance. If you're using the enteric-coated capsules, be sure to swallow them whole. If it's the chewable form, chew thoroughly before swallowing. For the liquid form, use a special measuring device to carefully measure the dose. It's important not to use a household spoon as it may not provide the correct dose. Some brands of this medication also need to be shaken well before each use. If your condition persists or worsens, or if you suspect a serious medical issue, seek medical assistance immediately. If you experience a fishy aftertaste, nausea, bloating, or burping after taking this medication, it's important to let your doctor know. However, it's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects, but it's important to contact your doctor if you notice any unusual bruising or bleeding. In rare cases, a serious allergic reaction can occur. Seek medical help if you experience symptoms such as rash, swelling, severe dizziness, or difficulty breathing. Keep in mind that this is not a complete list of potential side effects, so if you experience anything out of the ordinary, it's important to consult your healthcare provider. As for the best time to take this medication, it's generally recommended to follow the dosage instructions provided by your doctor or pharmacist. They can advise you on the optimal timing and frequency for taking Omega Monopure DHA EC790 Mg-675 Mg-118 Mg-1 300 mg capsule delay rel Lipotropics miscellaneous. Before starting to take Omega Monopure DHA EC790 Mg-675 Mg-118 Mg-1 300 mg capsule delay rel Lipotropics miscellaneous, it's important to talk to your doctor or pharmacist if you have any allergies, especially to fish or peanuts/soy. This product may contain inactive ingredients that can cause allergic reactions, so it's essential to discuss any concerns with your pharmacist. If you are pregnant, it's important to only use this medication if it's clearly needed. Make sure to have a discussion with your doctor about the potential risks and benefits. If you are breastfeeding, it's uncertain whether this product passes into breast milk, so it's best to consult with your doctor before continuing to breastfeed while taking this medication. When taking Omega Monopure DHA EC790 Mg-675 Mg-118 Mg-1 300 mg capsule delay rel Lipotropics miscellaneous, it's important to be aware of potential drug interactions. These interactions can affect how the medication works and may increase the risk of experiencing serious side effects. It's essential to keep a list of all the products you are using, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without first seeking approval from your doctor. It's crucial to prioritize open communication with healthcare professionals to ensure the safe and effective use of this medication. If you or someone else has taken too much of this medication and is experiencing severe symptoms like losing consciousness or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, while in Canada, you can contact a provincial poison control center. Make sure to schedule regular lab tests and medical checkups while using Omega Monopure DHA EC790 Mg-675 Mg-118 Mg-1 300 mg capsule delay rel Lipotropics miscellaneous. These tests can include checking your cholesterol levels and liver function. It's important to keep all of your medical appointments and follow up with your doctor for further information. If you are taking Omega Monopure DHA EC790 Mg-675 Mg-118 Mg-1, 300 mg capsule, delay rel Lipotropics miscellaneous on a regular schedule and happen to miss a dose, simply take it as soon as you remember. However, if it is close to the time of your next dose, it is best to skip the missed dose and continue with your regular schedule. It is important not to take a double dose to make up for the missed one. When it comes to storing Omega Monopure DHA EC790 Mg-675 Mg-118 Mg-1, 300 mg capsule, delay rel Lipotropics miscellaneous, it's important to follow the storage information printed on the package. Make sure to protect it from light and moisture, and avoid storing it in the bathroom or freezing it. Keep it out of reach of children and pets. When it comes to disposing of the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.